So it's my pleasure to introduce as our first speaker, a friend of mine, somebody who I've seen speak many times, Dr. Andreas Bienert. Dr. Bienert is a licensed professional counselor and a licensed substance abuse treatment practitioner, that's easy to say, in Virginia, as well as a nationally certified counselor. He is highly regarded for his work with individuals recovering from addiction and trauma in both inpatient and outpatient settings. Dr. Bienert has extensive experience helping children, adolescents, adults, couples, and families. At Master Center, he oversees all clinical services to include therapy, coaching, and health navigation. He is an assistant professor at Colorado Christian University, overseeing the substance use disorder counseling emphasis in the Master of Arts in Clinical Mental Health Counseling program. Additionally, he is a member of the advisory committee for the International Registry of Counselor Education Programs, where he contributes to quality assurance in international counselor education programs, and a committee member of the Virginia Association of Addiction Professionals. Please join me in welcoming Dr. Bienert.
Good afternoon, everybody. It's my pleasure to come before you today and share some thoughts with you in regards to what is it that we're here to talk about. I've been asked to share some specific thoughts in regards to what is addiction, what is this illness, what is this thing that so many of us are confronted by, either on a clinical and treatment side on a regular basis, but also perhaps individually as our lives, I'm assuming, all have been touched by the illness to a certain extent. So thank you so much for this wonderful introduction. Thank you so much to all the vendors who have come out to support this event. And I hope that we'll have a meaningful conversation here this afternoon in regards to such. I believe that there are some slides that will be shared with you as well. So just a few slides here to share with you and as we navigate this conversation here within the next 30 minutes or so. My understanding is that you'll also have access to this information following the presentation as well. There's some information on the slides that I see is a little bit dim as well, so if it doesn't come through and you want to review them later on, you're more than welcome to do so. But let's start with this question of answering what is addiction. I don't know about you, but prior to me entering the field as a treatment provider, I had limited amount of information in regards to what addiction really is. Prior to becoming a student within clinical mental health studies and so forth, I heard about addiction. I knew that it was out there, but not personally having been touched by the illness, on a familial level, for instance, very little information. So let's break this concept down in that respect. For many, many years, I would say, going back a few centuries, a lot of individuals might have associated addiction with quote-unquote bad behavior and poor decision-making. Going back, let's say 30, 40 years, for instance, that's essentially how we viewed addiction and behaviors associated with such. Individuals were labeled as bad people who engaged in substance use and subsequent have engaged in quote-unquote what we would consider some poor decision-making. But were these people really bad people, or were they suffering from an illness? We didn't have the understanding and the luxury of understanding that we do have today. But back in the day, we associated addiction with bad decision-making. Who engages in bad decision-making? It's poor, it's bad people, essentially. And what did we do with bad people for a long time? Well, the thought was, if we remove them from society, then we'll solve the issue. Did that really help? Not necessarily. In fact, it actually made things a little bit worse as well, because the illness that they were suffering from had been left untreated, respectively. Fast forward a few years, certainly neuroscientific research, has advanced, and if you ask me as a treatment provider, I believe that neuroscience is one of the best things that ever happened to us as a field, because it's really helped us understand what is happening within a person's physiology, what is happening within an individual's nervous system that perhaps may lead them to quote-unquote bad decision-making and consequences related to such. Nowadays, we've recognized that addiction is a very complex illness that involves the nervous system, that involves decision-making, that involves behavior, and a lot of other factors as well, which we'll talk about here in a minute. But in one way in which addiction can be described is, addiction is a complex chronic disease that involves compulsive drug seeking and use despite harmful consequences. It is a disease of the brain that affects the way individuals think, feel, and act. We essentially nowadays assume that addiction, yes, both has to do a lot with choice, but there's also a disease element that needs to be recognized. Recognizing it as a disease of choice because it's the very part of the nervous system that is responsible for decision-making and choice that is impacted to a great extent. And when we refer to that part of the nervous system, we basically talk about our frontal cortex that we all need on a regular basis, on a daily basis, right here and right now, to engage in full executive functioning. So addiction is a brain disease characterized by compulsive substance seeking and use despite the occurrence of negative consequences. It involves changes in the brain's reward system, leading to cravings, withdrawal symptoms, loss of control over drug use. So 3 important elements when it comes to understanding the illness of addiction. It's a brain disease, it involves compulsive behavior, and as a result of such, increased loss of control as well. Through the gift of neuroscience, we understand that addiction alters brain functioning. It affects the reward system, motivation, as well as self-control. Who of you would say they've heard about dopamine before? Dopamine is a neurochemical generated within the nervous system that essentially leads to us recognizing that we are engaging or experiencing a pleasurable experience as a result of the activity that we are encountering. Dopamine is released when essentially the reward is particularly pleasurable. We can all do things, various different things, that lead to pleasurable experiences. Think of your hobbies. Think about the things that you really enjoy doing. Those things are great and lead to natural rewards of dopamine. But then we might engage in substance use. Okay? What substances essentially differ from naturally occurring dopamine rewarding activities is that those rewards are 1,000, 100,000, 1,000,000 times more pleasurable. The amount of dopamine that is released into the nervous system as a result of substance use across the board, whether it's alcohol or other chemical intoxicants, is so much more greater. So the brain says, whoa, I really like this, and as a result of that, I want some more of it, because of the amount of pleasure that was experienced. And as a result of that pleasurable phenomenon, dopamine flooding that takes place, the person is then encouraged and more likely to re-engage in that activity. But there's also this sense of blindfolding that takes place as well. I call it essentially the deceiving aspect of the illness, where the illness essentially basically says, well, let me put some blindfolds on, let me make sure that you don't find yourself, in awareness of all the other things that I bring with me as far as potential negative consequences. We recognize that as a result of one's substance use, typically other psychosocial factors of one's lived experience have or suffer from a negative impact. There's different types of addictions, okay? Different substances across the board can be abused, including alcohol, cocaine, heroin, opioids, amphetamines, marijuana, benzodiazepines, tobacco, just as a few examples. But then the other component of addiction that we don't talk as much about, even as a treatment community, would be considered behavioral addictions. As clinicians, essentially the manual that we abide by when it comes to making clinical decisions as well as informing our treatment approaches is called the DSM-5, the Diagnostic Statistical Manual of Mental Disorders. Basically talks about all forms of substance use, but the only kind of behavioral addiction that is present and recognized within the DSM-5 in today's version is gambling disorder or gambling addiction in that respect. But there are so many other behavioral addictions that are beginning to gain traction even within the research community. In addition to gambling, we would talk about shopping, we would talk about internet. Video games, work, exercise, food. One that I don't have listed here is social media, okay? The kind of dependence we all experience when it comes to these things right here, okay? Have you ever encountered the phenomenon of losing battery or losing power within your smartphone, and you are, let's say, a couple hours away from the next outlet to plug in and charge? My anxiety goes through the roof. I was like, oh my goodness, I'm gonna miss emails, I'm gonna miss messages, okay, something's bad's gonna happen with my family, and I'm gonna, lose that connection in that respect. There's a high degree of dependence associated with the way, smart devices and social media and all things related to such have impacted our psychosocial well-being in that respect. So when it comes to the recognition of what addiction really is, yes, it is substance related, but there's also this very big elephant called behavioral addictions or process addictions that we have to take into consideration in formalizing a comprehensive approach and knowledge around that. There's different conversations out there in regards to, what may cause an addiction. We recognize addiction as a complex disease influenced by various multiple different factors. These factors can include genetics, environmental influences, trauma, mental health conditions, as well as social pressures as well. And there's lots of different symptoms that come along with the presence of addiction as well. First and foremost, the one symptom that typically stands out to individuals the most is the occurrence of cravings. Oftentimes when I may clinically evaluate someone in regards to the severity of their substance use or addiction-related problem, one of the questions that I ask first is, are you experiencing cravings that are associated with your substance use? So essentially it's an intense urge to use the substance or engage in the behavior. And alongside with that also comes the experience of withdrawal symptoms. Just earlier I've mentioned, quote unquote, my dependence on my smart device, essentially. When I don't have access to it, that anxiety that increases within me would be considered a withdrawal symptom. It's a physical or physiological form of discomfort when not using the substance or engaging in the behavior, for instance. Of course, we treat quote-unquote withdrawal symptoms much differently when it comes to the difference between substance use-related withdrawal symptoms and or behavioral forms of dependence. Then there's also this natural form of tolerance that our nervous system basically develops. Tolerance is explained as needing more of a substance or engaging in the behavior to achieve the desired effect. The more pleasure is released within the nervous system, the more dopamine flooding occurs, the higher and higher and higher that threshold of tolerance essentially increases. So in order for me to have the same effect or generate the same effect over time, I'm going to have to up my use. I have to up my engagement in the behavior, which as a result also translates into our understanding that addiction is a progressive illness. Yes, it may initially start with casual recreational use of a substance, but as the individual continues to engage in that behavior or utilizes that substance, tolerance is going to increase. With that, the amount of the substance that needs to be consumed in order to still generate that same neurological effect, that has to increase as well. So eventually, individuals cross over that threshold of, or moving from quote-unquote recreational substance use to substance abuse to then what we would consider addiction in that respect, where in addition to cravings, withdrawal symptoms, increased tolerance, we would then begin to see the neglect of responsibilities, prioritizing substance use or behavior over work, school, or family-related obligations. Legal and financial problems might be encountered as well. All of a sudden, there's this experience of legal trouble or financial difficulties due to substance use or behavior as well. When I look at these list of symptoms related to addiction, I'm looking at an illness that is trying to take me down. I'm looking at an illness that is trying to cause severe destruction within my life. And clinically speaking, the model that basically makes most sense to me in regards to understanding what addiction really is quote-unquote called the biopsychosocial spiritual model of addiction. That is a mouthful. Say biopsychosocial spiritual really fast. Okay, I'm gonna break that concept down for you, but it essentially summarizes what I've introduced to you already. We recognize that addiction involves a very complex interplay in regards to biological, psychological, social, as well as spiritual factors that do contribute to substance use disorders. It emphasizes the holistic approach that we would also take in regards to helping individuals who are suffering from the illness as well. When it comes to certain biological factors, we've already briefly talked about genetic predisposition. There's some really good research out there that essentially describes that about 40 to 60% of all individuals who suffer from the illness of addiction do have genetic predisposition within their family history. Basically means that other family members in times past have suffered from substance use or addictive behaviors as well, and there's a certain genetic component, a certain genetic vulnerability that is passed down from one generation to the next. So the research says about 40 to 60%. When it comes to gender-specific studies, there's some research that suggests it's about 33% of all males who suffer from addiction to also have genetic predisposition, and only about 9% of females who suffer from the illness do encounter genetic predisposition. But in addition to genes, yes, genes are powerful, they don't necessarily dictate the end result. In addition to certain levels of genetic predisposition, there's neurochemical imbalances, like we've talked about already. Addiction alters brain chemistry, impacting the reward systems and decision-making. And there's other physiological factors as well that include age, gender, the overall health of the individual that influence the risk and individuals' treatment responses as well. So biologically speaking, incorporating genetic predisposition and neurochemical imbalances, there's a greater risk of individuals basically engaging or finding drug liking of particularly pleasure. Then there's social and environmental factors within addiction as well. Talked about family history a little bit here from a genetic perspective, the power of peer influence, okay, that might be encountered, certain social norms, peer pressure that can strongly influence substance use, certain socioeconomic factors, poverty, unemployment, and lack of access to resources can also increase that vulnerability. Particularly when it comes to socioeconomic factors, there's a certain degree of psychological pain that might be encountered as well. As a result of that pain that's encountered, well, there's one thing that it can take that pain away. There's one thing that can take that stress away. If I engage in just some substance use, perhaps I don't have to worry about that very thing that is bothering me for some time because it's turning off that part. And then there's certain cultural influences. Cultural attitudes towards substance use can shape individual as well as behavior. And then last but not least, certain spiritual and existential factors that also need to be recognized within addiction. When we talk about spirituality from a clinical perspective, we don't necessarily approach that topic from a religious or faith-based perspective. Spirituality encompasses meaning, purpose, finding hope within one's lived experience, in addition to connection and having a sense of belonging to something or somebody within our lives. Transcendence and spirituality. Addiction can be a symptom of deeper spiritual or existential struggles as well. So while we can use the biopsychosocial spiritual model in informing our understanding of the complexity of the illness, we also recognize that each one of those four factors sort of create an avenue in which the illness introduces itself, but then also grows within one's lived experience. And as a result of that, its mission and objective is, again, to take the person down and to cause destruction and disconnect on all four levels, all four factors that basically describe us as human beings. So when we want to integrate this model for a comprehensive approach, biological, psychological, social, as well as spiritual, we recognize that through the destruction that the illness causes, it also gives us an opportunity to basically foster reconnection. Okay, we can't talk about addiction and its negative baggage that it brings along without talking about treatment and ultimately recovery, which we're here to discuss. Through treatment, we can help individuals biologically reconnect. We might introduce an abstinence-based approach or a medically assisted approach to treatment that essentially allows for the nervous system to heal. The brain is magnificent. Okay, similar to other quote-unquote ailments that we might encounter. For instance, I might cut my finger with a kitchen knife and I may have a scar for quite some time. There might be some bleeding. I might have to take good care of that wound, but eventually my finger is going to heal, okay, and I'll be able to use it in full function again. The brain is very adaptable. Yes, there's negative impact neurologically speaking, but if we help the individual slow down a little bit, we expose the nervous system to an environment that is conducive to their healing and neurological regrowth, the nervous system can heal. Therefore, biologically, physiologically speaking, new neurochemistry can be generated. Psychologically speaking, when it comes to helping individuals take good care of themselves personally as well as from a mental health perspective, helping individuals get back in touch with their feelings, okay? Helping individuals get back in touch with themselves. Actually begin to focus on that trauma that might have happened quite some time ago that substances have helped to essentially repress, okay? Through various different forms of therapy, we can help individuals grow psychologically and reconnect with themselves. Socially speaking, oftentimes we utilize the quote-unquote slogan that basically says, it takes a village to recover. I think that is very much true, even from a treatment perspective. Oftentimes it does require a multidisciplinary approach to helping individuals. That does not necessarily have to end at the professional side of treatment. There's a big community element to treatment and recovery that needs to be discussed as well. Community-based support groups, peer influence is so powerful and helps individuals transition from a bad environment to a healthy environment in that respect. And then, spiritually and existentially speaking, last but not least, finding meaning, purpose, and connection is such a goal in regards to this biopsychosocial spiritual approach to helping individuals find recovery and healing. In summary speaking, when it comes to this impact of addiction as well, it causes health problems, family issues, financial difficulties, as well as legal problems. So with that, yes, we can focus on the biological and psychological side of helping individuals find healing, but we've also learned throughout the years that focusing on social determinants of health, what are the basic needs of individuals in order for us to live productive lives, there needs some assistance that needs to be provided here as well. Formally speaking, there's lots of different treatment options available, certainly as represented by our vendors here today as well. Different levels of care, inpatient programs, residential programs, outpatient programs, partial hospitalization programs, intensive outpatient programs, outpatient programs, peer-based community support, and so forth and so on. Lots of different options. Oftentimes it's difficult for individuals to even conceptualize and figure out, okay, where do I really start? Okay, what kind of help do I really need? It's really important that we assess individuals appropriately at the onset of their readiness to change and finding healing and desire to find healing and recovery, and to then place them appropriately within the right level of care, but also the type of treatment that works with the rest of their life as well. Oftentimes, treatment is comprised of therapy, particularly utilizing cognitive behavioral approaches that can help identify changes in negative thought patterns and various different behaviors, for instance. That's just one of the therapeutic modalities that we tend to emphasize on. Medication assistance, utilizing innovative technologies, medically speaking, to help manage cravings, withdrawal symptoms, and underlying mental health conditions as well. And then again, the importance of support groups. Groups like Alcoholics Anonymous, Narcotics Anonymous, or others provide peer support and guidance for one's recovery process as well. When it comes to this pathway from active substance use to finding sustained recovery, there's essentially a certain trajectory that we can introduce and encourage individuals to follow. Starts first oftentimes with detoxification, making sure that individuals don't actually suffer long-term from withdrawal symptoms. We recognize that suffering from withdrawal symptoms is also very, very dangerous. There's a lot of individuals who have attempted to manage withdrawal symptoms on their own without the proper medical guidance and support that they might have needed, and unfortunately didn't survive that withdrawal process. We recognize that withdrawing from alcohol use, for instance, is one of the most severe physiological processes and traumas that an individual can put their body through in that respect. So it's really important that that is done under medical supervision, if at best possible. But then once an individual is psychologically stable and the brain has adjusted, to the sudden neurological shock that comes with not using substances all of a sudden, we want to introduce therapy, counseling, medication assistance, recovery support groups, various different aspects of relapse prevention, and ultimately leading to lifestyle changes as well. Building healthy lifestyles with positive routines, support systems are essential. Recovery does not represent just stopping one's substance use. Recovery represents a lifestyle change that focuses on those biopsychosocial spiritual factors that initially have caused an individual to find quote-unquote destruction from their substance use. And I would like to end with this slide by basically introducing the 8 dimensions of wellness. SAMHSA, the Substance Abuse and Mental Health Services Administration, also refers to the Wheel of Recovery, for instance, that essentially describes the fact that recovery, again, does not just come with the discontinuation of one's substance use. Recovery encompasses emotional healing, healthy coping with life, creating satisfying relationships, for instance, finding financial security, regaining employment, satisfaction with current and future financial solutions that can be gained from one's employment, for instance. Socially speaking, developing a sense of connection, belonging, and a well-developed support system. Spiritually speaking, expanding our sense of purpose and meaning and connection in life through our relationships and different spiritual practices. Occupationally speaking, again, finding personal satisfaction within one's employment. Physiologically speaking, recognizing the need for physical activity, diet, sleep, and nutrition. Oftentimes, my conversations with my clients focus on the fact of how can we focus on helping you take good care of yourself again first. What does that mean to one? Intellectually speaking, recognizing creative abilities and finding ways to expand knowledge and skills. And then last but not least, one's living environment, making sure that one's living environment is of good health by occupying pleasant, stimulating environments that support overall well-being as well. So in closing, addiction is a complex illness that is driven by biopsychosocial spiritual factors that manifest within one's lived experience. It causes destruction. That's the ambition of the illness. But thanks to neuroscience, thanks to treatment practitioners, I see many of you here in the audience as well. Thank you so much for everything that you do for your respective patients. We can utilize different approaches to introduce healing and recovery from this destructive illness to so many lives, and as a result, cause positive change and helping individuals reconnect on all those levels where they have found disconnect within their lives. Thank you so much.